Hi everybody, I'm Dr. Lily Talakoop, and hair loss is a really big problem. It happens in men and it happens in women, and it can start very early. Once it starts, the transition into having full head of hair that's lost is very fast in some people. And in women, it could be very fast after pregnancy, after stress, or after taking certain medications. Hair loss is a very big problem, and there's very little medicines on the market that can fix it or even treat it. Very little has been done in the last 25 to 30 years with hair loss medications, and a lot of them have side effects. This treatment is the first and only natural way to actually regrow your hair. It's called PRP, and we're doing it here now. It's a very simple mechanism by which we draw blood from the patients. The patient's blood is then spun in a centrifuge. The centrifuge has a circulation of the cells where the cells then separate from the plasma. Once the cells separate from the plasma, we extract out the plasma and re-inject it back into the scalp. It's safe because it's your own blood. It has growth factors that stimulate the hair cells to grow, and there's really no risk other than a couple of small injections. It's very easy to do, and once we get your blood and inject it, after 5 treatments, you will see pockets of hair growing. Some people love to do it so much, we do it every month, and some people do 5 treatments and come back a couple years later and do a touch-up. We do it in our office. It takes 10 minutes to do the procedure, and you can go back to doing your regular activities right after. Hair loss is a really big problem, and this is our way to actually help you regrow your hair. So if you're having any type of hair loss, including hair loss from stress or babies or postpartum or menopause, or even hair loss that you've had because of genetics, we can help regrow those cells by injecting your own growth factors back into the scalp. So I'm going to show you step by step how we're going to do it. Now we're back here in our lab, and we have 2 tubes of blood that we're going to put in this machine called the centrifuge. We put it in here, the centrifuge is turned on, and it spins at a very high velocity. That velocity causes the cells to separate, and you'll see in a second how the plasma separates from the red blood cells. This is the PRP that we extracted. This is the plasma. We have about 3 cc's of it. So I'm actually gonna use my needle and inject it back into the scalp. Very easy. Here we go. Little small injections.
The quality here is so good.